Hi everyone, and this is Dr. Shannon, and today I am going to tell you about a very common condition, which is tennis elbow. So what is tennis elbow and what happens in tennis elbow? It's also called as lateral epicondylitis. Litis means inflammation. So it's inflammation of the muscle which is the extensor carpi radialis brevis muscle of your forearm, which attaches to the lateral side of the elbow joint, the lateral head of the humerus bone. That is what happens in tennis elbow. It's inflammation. Next, why tennis elbow happens? It happens because of overuse of this muscle, causing inflammation because of repetitive use. So continuous use of this muscle will cause inflammation on that tendon which attaches there, causing a tennis elbow to occur. It is very with the name that states, it's saying tennis, it's a very common racket sport injury. It can also happen in badminton and squash, but not necessarily happen only in a racket injury. Anything that has repetitive movement, for example, painting, carpentry, plumbing, or even cooking where there's too much of chopping or stirring, it can happen. So any activities where there's repetitive movement, tennis elbow can happen. Let's go ahead with what are the signs and symptoms of tennis elbow. Three most important signs are: first, pain. Pain is always on the lateral side, on the lateral point where you find it very tender. The lateral condyle of the humerus, that is the most tender spot where you'll have tennis elbow pain. You can palpate the spot to know exactly on the lateral side. The next is burning sensation on the elbow and the outside. So burning sensation can also happen on the forearm, on the muscle of the extensor carpi radialis brevis, or it can also travel up to your shoulder, the entire burning sensation. The third is there's a weak grip strength. Now because of this muscle overuse and pain, the grip strength is what is affected. The last is where because of pain, even doing any activities like shaking or squeezing or even lifting up a glass or writing with your pen can also be difficult. This is exactly what tennis elbow is. Now let me tell you how you can heal your tennis elbow at home. The most important thing is icing. So you need to ice your elbow at least 10 to 15 minutes every 2 hours to reduce the pain and inflammation. Along with that, you can also wear tennis elbow sleeves or brace that comes to ease the pressure of the muscle tendon on rubbing on the joint. These are very important things. Now, even doing this, if your tennis elbow pain doesn't come down, you need to visit your physiotherapist, where we will show you more exercises and therapies that you can do at the clinic to ease tennis elbow. In my upcoming video, I will show you exercises for tennis elbow at home and also how to test if you have tennis elbow. Do watch my upcoming videos, and if you like this video, do like, share and subscribe to my channel, Dr. For You.